How to complete the renal assessment. We're going to knock on the door, introduce ourselves, and explain what we're getting ready to do. Very important with the renal system that we obtain the vital signs, especially the blood pressure, the pulse, and the respiratory rate. All of these can be involved with the fluid volume status. If it's fluid volume overload, we're going to have an elevated heart rate. We're going to have an elevated respiratory rate. We're going to have an elevated blood pressure. If it's fluid volume deficit, we're going to have a low blood pressure, but our heart rate and our respiratory rate are going to remain elevated. We need to assess our skin turgor. Once again, we're going to be assessing on the forehead, the clavicle, or the sternum. Is it prompt or is it prolonged? Is it slightly tented or does it remain tented? We need to assess the client's weight. If we have the ability to obtain the client's weight on a scale, that's really important. Otherwise, we need to ask what their current weight is. Is that up or down from what it normally is? Assessing their orientation or their mental status is very important. We need to assess any pain. Where is it located? What are the characteristics of the pain? In other words, is it sharp? Is it achy? Is it crampy? Is it burning? Is it stinging? Etc. The intensity. So on that scale of 1 to 10, is there anything that makes it better or anything that makes it worse? When did it start? Etc. What were you doing when it started? We need to inspect the skin color. So we're looking at those mucous membranes or nail beds. Is it pink, cyanotic, pale, erythemetic? Is there pallor? Is it mottled? We're assessing skin integrity. Are there any abnormalities noted? When a client has kidney failure, one of the things that we commonly see with kidney failure is the client has a lot of itching. So if they have itching, they may have scratching. Skin might be very dry. So we definitely need to assess the skin. Do they have edema? When we assess edema, remember, over the tibia is where we start. Do they have any pitting edema? So it can be trace, it can be 1 plus, 2 plus, 3 plus, 4 plus. It may be non-pitting. Where's the edema located? So what is the level? Now, we may not always have the opportunity to assess the client's urine when we're talking about the renal system, but we definitely need to at least ask about it. So when we're assessing the renal system, we need to determine what color is the urine? How much are you peeing when you pee? Is it just a very small amount or are you able to pee a large amount? What color is it? Is it really pale? Is it dark? Is it really dark? And does it have an odor to it? And how frequently are you having to go? Do you have any pain when you urinate? These are all very important questions. Then we should ask the client, when is the last time that you voided? We're going to have them in a supine position and we need to palpate the bladder. So again, have them empty the bladder if necessary. We're going to feel just above the symphysis pubis, but definitely below the umbilicus or the belly button. We're going to palpate. If there is urine in the bladder, you may be able to feel the bladder, and it's going to be felt as a firm, rounded object just above that pubic bone, the symphysis pubis. But be aware that if the bladder is empty, you may not be able to palpate this at all. We definitely need to auscultate the lungs. If a client has renal failure, they might be fluid volume overloaded, so we might begin to hear crackles in the lungs. Then we do our closure. So, is there any questions you have for me? Is there anything that I can get for you? Making sure that the bedside table is within reach, the call light is within reach, that the bed is in its lowest position and the upper rails are elevated if necessary.